My sons and my godson were coming back from a trip to Lynchburg, Virginia. Then I see the car coming, and he's on the wrong side of the road, and I'm thinking, is this car going to hit us? And in that second, the car hit us head on. I remember yelling and saying, oh my God, they hit us. And I remember the kids screaming. My car rolled over several times. I knew from the moment the car stopped that I was injured. I could tell by the positioning of my leg. I wanted to go to Duke. I was transported to the emergency room at Duke Hospital, where I was met by several emergency room responders.
And then the orthopedic service evaluated her and deemed her appropriate to go immediately to the operating room.
They performed surgery to put on an external fixator.
An external fixator looks very similar to an erector set. So we apply pins to the bones that aren't broken, and then those pins are connected by rods to help stabilize the leg.
After the surgery, I went into the 6100 unit. The doctors came in and they told me that it was one of the worst injuries they had ever seen, and that one of the major options was to have it amputated, which was a frightening scenario. It made me feel horrible. Amputation stunned me for a few moments. I am first a wife, I am a mother, I am a teacher. I adore life, I love living, and I was more than emotional.
I came to Duke in November 2010, and my job is working for EVS in housekeeping on 6100. I come in, she was crying and crying. What's wrong?
The doctor came in. He knows. Cut my leg off. I explained to her that I had just been told that they were going to cut my leg off.
And I said, you need to wipe all those tears away. You're not going to lose your leg.
If she would have just been doing her job, then she just would have been like, oh, well, let her cry. But she didn't. She took her time to make me feel special. She just gave me that love that I needed at that particular moment. She was my angel.
I was there every day. I come from a large family, and we were brought up to care. The next time I see you, you will be walking to see me. We all work as a team on 6100, and that's what I love.
Once I left the hospital, my life became almost a standstill for a brief moment. No quick decision was made.
Due to the magnitude of her injuries, 99 times out of 100, her leg would have had to have been amputated. She happened to see one of my trauma partners who sent her to see me for a second opinion about what would be best for her.
My first appointment with Dr. Adams was the most awesome experience ever. Dr. Adams assured me constantly that amputation was the last option. He was just so calm.
Have you thought about the amputation?
We have.
It's not the only option. I think there are a couple other options. In her case, I saw an opportunity. I just went to our major conference and I learned about 3D printing technology. And I talked with her and I said, you know, there's a chance I might be able to save your leg.
He said, go back home and research it, and you would be the first at Duke to have this if everything goes through. I thought, ooh, I'm gonna be first. And there was no doubt in my mind. I thought it was kind of like I was gonna be Superwoman or Wonder Woman. And I was extremely excited about it, even though I didn't know what entailed.
I was scared. I mean, I didn't know if it was going to work. Most of the 3D printing that's happening in medicine now is modeling, so it'll help the surgeon plan for his surgery. In this case, this was a 3D printed implant to be placed inside the body.
Can you guys hear me?
The greatest thing is it's all custom, so no matter what your bone defect is, I can create an implant to match that defect. I explained that I was going to take her CT scan and send it to the company.
Are you able to create a hole in the center of this implant and then also show me what an intramedullary rod would look like in this situation?
Definitely, yeah. I could go in there and put that in place so you can kind of see that in reference to the cage.
We have a teleconference, and they show me in real time they're remodeling her bones. I give them advice on where her bones need to be, the size of the defect, what my surgical approach would be. And then from that information, they use this new technology and 3D print a titanium cage that would fill the bone that she had lost.
That's incredible. Now, can you make a rough model of the implant?
The process took about 4 months. Basically, one day a box arrives with her implant in. It was very surreal. To finally hold this implant in my hands was amazing. Then within the next day or two, we were implanting it into her body. I kept my operative team at a minimum, and I just tried to stay calm.
This is Ruth Smith-Lee. We're doing...
I had done this type of surgery, not using this implant, but this type of surgery many times before. The surgery took several hours. We're never sure if it's gonna take, so she had already had this traumatic injury, a second insult by having this surgery. We're not sure how the nerves are gonna function, how the blood vessels are gonna function. I had my fingers crossed, hoping that she would be able to heal this, that her leg would survive, and that she would be able to walk on this leg.
After surgery, it was casting and casting and casting. You ready for your cast?
I am.
He was looking to make sure this thing was strong enough, so just part of helping her heal.
Every time I would go, I would get a different color cast.
Still want orange?
Orange, 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 orange.
And it would always be a bright color because that's how I felt. I always felt bright and happy when I left there. They always had jokes. They always just made you feel like you were family.
Hi, I'm Rose. I'm helping out.
I treat people like I want to be treated. You know, I look at her, this could be my mom, this could be my sister.
It was always the progress. They always assured me that I was progressing to the next level.
We kept her off of it for 3 to 4 months while it healed, and then we gradually started to allow her to put weight on it again.
And then he said, try without a cast, see what happens.
It was unbelievable. It was an unbelievable experience to have the cast come off. I wanted to go back to work. I teach special education students, so for me, when he stated I could go back, I knew that the impossible had been made possible.
I wouldn't have been able to do this surgery at many other places, and I have to be thankful for Duke for allowing me to go down this road. There's a lot of regulatory issues, a lot of safety issues that need to be dealt with before we can do it, but in the end, everyone saw the utility of this implant and the impact it could have on Ruth's life, and we did it. I'm ecstatic.
Everybody was so excited about me coming back. One of my students said to the other, "The sheriff is back in town." And I thought, yeah, I'm back.
Seeing patients come in pain and walk out skipping, it's just been a great journey to be a part of.
It was a team effort between her and us. She had the will, she had the strength, and we just helped her along.
It's amazing because I had told her that she was going to walk again.
I'll always hold them close to my heart. They were simply amazing people. I don't know if I'll ever meet anybody like them again. I mean, I don't know if there are words that can ever explain, how I feel about them. I don't think I can say thank you enough. I think thank you is not enough. It's not enough.